So Oliver, another thing I really struggle with PrEP, I'm super busy. We've got, 10 patients in a half day coming through here.
Mm-hmm.
And I think these clients probably need some counseling, but I don't know what type of counseling they need, how much, when do they need it. How do you work that into a PrEP visit?
Right. That is something that a lot of providers are concerned about, and I think it's a barrier to providers providing PrEP, but I think it's actually a lot easier than people think. And I also think it's really important. We know from a number of studies of counseling and HIV prevention in MSM prior to the PrEP era that it's hard to prove that counseling actually reduces risk. But I think there may be a really important role for counseling in PrEP, and that was suggested by some data in San Francisco looking at participants in the IPREX trial, which showed that having regular access to open-minded, non-judgmental counseling helped participants stay adherent to their Truvada. So what I like to do is kind of a really quick and dirty sexual behavior counseling session with my patients, and it takes 5 minutes. And it's really sort of consists of the following steps. The first is, tell me a little bit about what's been going on with you sexually in the last couple months. How many partners, men or women, any anal sex, protected or not protected, or condomless or with a condom. Just give me kind of an overview of what's been going on with you sexually and in terms of prevention. And that sort of opens the door for them to talk a little bit. And it also allows you to do kind of an inventory of where their risk is. And you can correct any misimpressions they have or probe a little further. And then I like to get very concrete, and I say, okay, so based on what you told me, here are some areas that might be risky. Tell me what your HIV prevention plan is. And in fact, if you could summarize your plan to stay HIV negative in 5 or 6 bullet points, what would those bullet points be? And that, if they have a prevention plan, it lets them sort of summarize it. If they don't have a prevention plan, it actually helps them synthesize one. And then I say, great, thanks, and we'll keep talking about this at your next visit. And that's pretty much it. And 5 or 10 minutes, and it may go on a little bit longer, but for some clients that's a good thing because it may be their only chance to talk about what they're really doing.
That sounds doable.
It's totally doable.
I like that approach, actually. That's really nice.
It's totally doable. Okay, I have a question for you.
Oh.
Yeah.
Please ask.
So, I have a lot of really savvy patients who have heard that if their partner has if their partner is HIV positive and has an undetectable viral load on antiretroviral therapy, that they're pretty much protected from HIV transmission. And yet they're also interested in PrEP, and they want to know, should they take PrEP in this setting or not? Does it offer any extra protection? And it's a really good question. So what do you think?
Yeah, I think that's another tricky area, and I think my main take home on that question is that PrEP is really a personal choice for the patient. And I hear a lot of angst from providers around that question. Should I be giving PrEP in this scenario? Doesn't this seem sort of unnecessary given what we know about how effective treatment is in achieving a suppressed viral load in terms of preventing transmission? But ultimately, the way I see it is my job as a provider is to give the patient all the information I can about what we know about these different strategies and how they work, and let them make an informed decision about what they want to do. So there's a couple of things that are important to keep in mind. One is, is this truly a monogamous relationship? A lot of people have outside partners. It's a common part of our culture. And it could be the negative person who has outside partners, and so maybe they need PrEP to protect them from their from getting HIV from a non-primary partner. Or it could be the positive partner who's having outside partners, maybe introducing an STD into the equation that could cause some transient increase in viral load. So being able to have a frank conversation around, well, what do you mean by monogamous exactly, is important. The second thing is we know that, like I said, STDs can cause transient increases in viral load. So what does suppressed really mean? You know, did your partner tell you they saw their doctor 6 months ago and everything was good and their viral load was suppressed? Are they really taking their meds every day? Are they having any trouble with refills or adherence? All those details are things that are difficult for the person who's not actually infected to know. So I think those are important caveats. And then lastly, we really see that for a lot of monogamous serodiscordant couples, the anxiety around the risk of HIV transmission in the relationship is a big deal. It really impacts their emotional health, their intimacy, the stability of the relationship. And so in those scenarios, PrEP, even on top of the positive partner being suppressed, I think can really make a true difference in that relationship and in the couple's health as a dyad, as a couple, and also individually. So I try to, really just lay all that out for the client and the patient and let them think about whether it makes sense for them.
I've definitely seen the effect of PrEP on lowering anxiety and helping couples to communicate more openly about what's going on.
It's really important.
Yep.